starting recording, and I'm going to hand over to Andrew Fox, who is a development worker for the Advocacy Service, Sunderland People First.
Thank you very much. So I'm hoping everyone can see the first slide with some pictures on.
Yes.
Wonderful. Okay, so I'm going to hand you over to Philip from our team.
I think Philip's still on mute.
Oh.
Right, when you're ready, Phil.
We are all members of Sunderland People First. Sunderland People First. Speak up for people with a learning disability, autistic people, and their families in Sunderland. We aim to improve services by focusing on independence, rights, choice and inclusion. Welcome to our Lunch and Learn.
Thank you, Phil.
Okay.
We'd like to start today by introducing our trainers. My name is Philip, and I am the youngest member of the team. Can I pass you on to other members of our team?
I'm Karen and I'm his sister, and he's definitely not the youngest in the team. And I help Philip. Samantha?
Hello everybody, I'm Samantha. I'm a development worker and self-advocate at Sunderland People First.
Hello, my name is Ian. I'm from Sunderland People First and I'm an advocate. Matthew Moon.
Hi everyone, I'm Matthew Moon. I'm a self-advocate at Sunderland People First and I'm also one of the directors there.
Hi, I'm Tony Ann Wood. I'm Sunderland People First and I'm an advocate.
Thank you, everyone. Thank you, Phil.
Mute yourself when it is someone.
I'm going to give Mr. Littleborough. Hi, Phillips.
My apologies. Keep me right, Phil.
Right.
We would be grateful if everyone that has joined us today could introduce yourselves using the chat box.
So I'm going to come off screen so I can see everyone again. So yeah, it'd be very kind if you could just use the chat bottom just to the chat box just to say who you are and where you're from. That'd be really appreciated. So I'm going to hand you over to Ian.
Mute yourself when it is someone else's turn to speak. Give everybody a chance to speak. We will have time for questions and discussions using the restriction to show you like to speak.
So these are just some slides that we use to support each other in these meetings, and just to make sure that everyone gets involved in the conversation and can ask any questions.
At any time, if you have any questions or comments, type them into the video chat. Don't have any background noise like televisions or mobile phones. Be kind and respectful and have fun.
And this probably seems a bit of a strange slide to share, but we'd really appreciate it if people could, as far as possible, have their cameras on. It's very difficult when we go to meetings and everyone's got their cameras off. Now we understand that obviously there are reasons for that. So Danielle's just come off on a camera, and there will be reasons why people have their cameras off. But if we have a big meeting where lots of people have their cameras off, it's very difficult for us to engage with people. So thank you.
Self-advocacy means working together as part of a team to support and encourage everyone to have a stronger voice.
So this is our kind of opening slide about the definition of what is self-advocacy, and this is one of our advocates called Matty. And Matty's shared this definition of, you know, self-advocacy, which we really like. So it's about working together as a team to ensure that everyone has a strong voice, and we're going to give you some examples of that throughout the lunch and learn session today. Matthew.
So yeah, we work together in lots of different ways to support people with learning disabilities and autistic people to have a stronger voice. So that basically means just making sure that information is accessible to every member of a community, raising awareness of barriers that people with a learning disability and autistic people face day to day, and delivering disability awareness training. It's also supporting people to think differently and understand what inclusion really means. So working in partnership with people and organisations to make sure that this happens, and campaigning for change. And here's some examples of that actually coming into practice. We've got a hashtag there, Stronger Together, and we're stronger together when we work together with lots of teams and organisations. It's all about coming together to make change happen. So
These are some photographs that we've taken of working together as a team with other groups over the last 6 months. So in the top left-hand corner, we had our AGM on Tuesday. So that was our annual general meeting where people came together to talk about our work. Top right-hand corner, that's a health and wellbeing activity that we run with another organisation called Media Savvy every Thursday morning at City Space in Sunderland. Matthew, do you want to say what the one with the police is? We won't get arrested, I can promise you. But we work really closely with the community.
Oh, yeah, so we work with the community engagement team, and that's Rob there as well, isn't it?
Yes.
Yeah. So we were doing some walks down by Roca to help people keep fit, and that sort of turned into our piece of work we call Moving Out of Lockdown, which is basically keeping people physically fit and healthy and getting them out and about because of the long period of time we're spent stuck indoors. So yeah, and it was really good. It was bringing people in the community together, and the police were there too to sort of break down those barriers between the police and the community. And yeah, it's another great example of working together. So.
And Samantha, I'm putting you on the spot a tiny bit, but I don't know if you wanted to talk. Just mention the photograph on the bottom right-hand side.
Yep, so that was, we went to the Restraint Reduction Network conference, which was in Leeds, yay! And we worked with another organisation called Sheffield Voices to put together a workshop around listening and the importance of listening. And apparently ours was the best workshop there. Not bragging or anything, but it was.
Thank you, Sam. So I'm going to come off screen just for one quick minute. We've got a question that Tony Ann's going to ask everyone, and we very much welcome if you could either just wave your hand to speak, or put anything in the chat, and we'll try and keep in touch with what people say and just kind of share people's thoughts. So screen share for everyone, and we'd be very grateful if you could share your thoughts. Oh, what have I done there? I don't want to leave. Tony Ann, this is our question for the group.
Right. How do students carry a learning disability and autism?
Thank you, Tony. So the question we would like to ask you as a team is, how do students currently learn about learning disability and autism? I'm going to come off screen so I can see everyone. Michelle and Danielle, you're very welcome to participate and give your own thoughts. So would anyone be brave enough just to share their own thoughts about how students currently learn about learning disability and autism? Anyone want to be brave? Oh, Michelle.
I think it was the same time as Danielle, isn't it? I'll go first and then I'll hand over to Danielle, and hopefully some of the students on the call, I don't know if they'll be brave enough to talk about their experience, but from what I know in terms of like the nursing programs, with the adult nursing, they have an opportunity to have a spoke placement within learning disability to get a taste of what that's like. However, they do get some theory, so like some lectures in university that gives them an idea. So that's the same thing with children and young people nursing, mental health nursing, but as well as, I don't know if you're aware, there are actually learning disability nurses who their main place training is all around how they can support adults and children with disabilities and autism. I'll hand over to Danielle.
Thank you, Michelle.
So yeah, similar to Michelle, I think it's a really, really mixed bag how students learn. Some students will learn through their own lived experience and people that they know. But to quote a takeaway from yesterday's session, if you've met one person with autism, you've simply met one person with autism. So lived experience doesn't give us everything that we need. There are certain theoretical elements that are included into course into the curriculum, and you know, people may stand up and have lectures and things like that about it, but I think that question kind of highlights a lot of the importance of what we're trying to achieve to find those learning opportunities anywhere else. So yes. Thank you.
Does any of the students that have joined us want to add anything? I'm going to keep checking the chat. So Natalie's put, oh right, so people are talking about the cameras. So Claire's put, hi, I'm a third-year podiatry student. We learn about ethical considerations, advocating. We don't learn about direct disability. It's more generalised, and autism is not included within the course. So that's very interesting. So in summary, I think some of the feedback that we've had from students, not necessarily students from Sunderland University, is that it is a mixed bag. As you said, Danielle, we know that people sometimes have online module courses. We know that people are involved in research, and we know that sometimes people learn from publications and books. And also some of the students that have joined us have shared how they've learned from family members who may have a learning disability or are autistic. So I'm going to hand you over to Samantha, if my computer works.
Sorry, couldn't find my mute button. So we believe that learning about learning disability and autism involves listening to experts by experience. So everyone here today is an expert on their own lives, the things you enjoy, things that make you happy, and what good support means for you. So we would like to share a few photos of things that make us smile and that are important to us. And we'd really like it if you could share in the chat something that either people don't know about you and something that makes you smile. So these are our photos, which show just a little bit about our lives and what is important to each and every one of us. And we're going to go round the photos and talk about that now. So my photo is of me in Leeds at a convention called Thought Bubble, which is a big art thing. And what's important to me is having the freedom to be myself. And that can be dressing the way I want, having coloured hair the way I want, but also being able to take part in things like movie conventions, comic conventions, art conventions, and be around like-minded people. And that really makes me smile. Tony Ann.
This is a photo of me with my good friend Julie Williams when we go out on the night when the town thought to go for a few cocktails and have a nice meal out, and we do like a lot of stuff. One time when I went out, my mum was worried about just making sure that I got home safely, because she didn't think that I would manage on my own going out around the town. I used to go around the town with my mum and her friends, but now she realised that I can manage on my own and making sure that I enjoy myself, because I'm an adult now and I don't need support, but she makes sure that I've got this thing that you call that makes sure location.
Yeah,
it's called location spotting, I think.
Yeah.
Yeah, so I've got that. So that's my life.
Thank you, Tony. You always share some wonderful photographs of nightclubbing.
And I think the next one is Karen.
Yes, Karen.
Hello. I'm Philip's sister, and I support him most of the time. But the photo there is of my children and my two of my sons and my two grandchildren. I actually have two great grandchildren, because my oldest son, the one standing up holding the little girl, that's not his daughter, it's his niece, and he has two grandsons. I usually have a good time with just me and Philip out on our own.
And
He likes to go to gigs.
you share some wonderful photographs, Phil, of all the concerts you go to, don't you?
Yeah. He likes going to the Metro Arena. He used to like going to the Empire, but we can't get a box unless we pay for extras, and he doesn't want to pay for extras, so he won't go anymore. What else do I? You're going to see Ed Sheeran, aren't you? And we've just been to see. We've just been to see him. Simply Red.
Thank you, Phil, and thank you, Karen. Matthew?
Yes, so I'm usually I used to be quite a socially anxious person, and I would not do well like with around people and crowds and stuff like that. But I've really, ever since starting advocacy, I've really enjoyed going out and spending time with people. And so that photo was taken, it was very cheesy, photo of me out in a cafe with some of our team, and also, funnily enough, some other university students. So yeah, and we had a really great conversation, really great day, and just had a very nice time. And the coffee and the food was very nice too, as you can probably tell. So yeah.
So this presentation is not sponsored by the Winter Gardens Cafe.
No.
So, Ian?
This is me. This made me smile when I was holding my nephew for the first time.
So, all of these photographs are very individual, and the message we wanted to get across is Michelle, I'm going to come off screen 1 minute. Sorry, Danielle, you said that you had a training session yesterday where the group had said if you've met one autistic person, you've met one autistic person. And it's very much the same for people with a learning disability. And you shared, I'm going to come on screen again, Samantha.
Yeah, so all of those photos, as you can see, there are a lot of things there that I'm sure a lot of you people sitting here today can identify with, you know, things that you enjoy, family, friends, socializing. And the whole point of this is when we learn to listen to people, you encounter a whole new world of learning that you don't get from books. There's no book, research project or online module that can really describe how individual we all are. And one of the quotes that we had about this was, "It opened my eyes and I learned to see the world so differently."
Thank you. Leanne.
Right. Self-advocacy have supported students from Sunderland University on our community placement, and we have all for this opportunity. These are some of the things that we have worked on together as a team.
Yeah. So we've had some amazing students that have joined us from Sunderland University. We were hoping that some of the students might be able to join us today, but I think the photographs hopefully show how much fun we've had working together. And we've just involved students in lots of different things. We've tried to mix it in terms of having virtual kind of Zoom meetings. But also the important thing for us is actually kind of meeting people face to face. So Tony, we went to a cafe in Sunderland, didn't we?
Yes, we did. It's the one that we opened with Healthwatch Daintree and Dee.
Yeah, so there's a new health and wellbeing cafe in Sunderland. So we met some of the staff there and introduced students to some of the people that we work with. We went to we organised where we invited students to come along and join the health and wellbeing sessions that we run for people, and we had lots of nice walks, and just sitting down having conversations with people was just really, really important for us. So hopefully those photographs just show how much we've enjoyed and valued the opportunity of supporting students. So, Tony-Ann.
Right. Our next bit is we spend time learning and share together through Zoom calls and face-to-face meetings. We including students to be part we worked closely with, setting students challenges that are reviewed by self-advocacy.
Yeah. So the second kind of slide, sorry, the second photograph is we had meetings where we introduced students to people and organisations we work really closely with. So that was with Wendy from Healthwatch in Sunderland. We met with colleagues from the community engagement team at Northumbria Police, and there's some colleagues there from our local health trust, CNTW. So it was just important that we had the learn and share together conversations where Healthwatch could come along and talk about their work. The community engagement team came along and talked about their work. One of the I'm going to come off screen a minute so I can see everyone. One of the things that we felt was really, really important was that at the beginning of the week, and this probably sounded a bit daunting for some of the students, we gave the students a kind of challenge from the team on the Monday. So the first day we said, could you use some of your time during the community placement to go away and research an area that affects people with a learning disability or autistic people. And I think initially there was a bit of a, how is that going to happen? And then we said, well, what we would like to do is for you to present that back to the team on the last day of your placement as a presentation to our group, and that, you know, self-advocates would give people feedback. And I have to say that some of the, well, actually all of the presentations and all of the areas that people researched were just quite fabulous. And I think we all got really emotional at times because people they'd spent an awful lot of time kind of researching areas. So one student researched hate crime. One student talked about the Learning Disability Mortality Review Programme. And one student talked about the importance of effective communication. And they presented to our team, and self-advocates gave feedback. And we were able to kind of include that as part of the review of the placement in terms of the research, but actually kind of it covered a lot of areas about how accessible the information was to our team, where they kind of, you know, researched, had they involved kind of people in those conversations. So that worked really, really well. And it's something that we kind of thought about, is that too much on the first day to give people a challenge? But actually the feedback that we had from students was how much they valued that opportunity. And although I think one student described it as feeling a little bit like Dragon's Den presenting, we're all very nice dragons. Well, some of us are anyway. So that worked out really, really well. So that's something that we wanted to kind of share with your team. So so we were, as I said, we were hoping to have some of the students join us for today's session. So two of the students that joined us, Laura and Morgan, and we had Danielle as well. And just going to share some thoughts and some quotes from the students that joined us. Students said that they felt that that our community placement was one of their favourite, if not their favourite community placement. And I think students really valued the opportunity of spending time with self-advocates, because as Samantha said, you know, there are lots of different ways that we can learn, but spending time with experts by experience, spending time with people with a learning disability and autistic people, was just worked really, really well. And we said at the beginning, there's no such thing as a silly question. We're not here to kind of, you know, embarrass anyone or to, you know, just ask us any question. And I think after the initial kind of, oh, this is a very new placement, people just built up relationships and just had some wonderful conversations with people. And that was certainly reflected in, you know, the face-to-face meetings that we had and the presentation that they gave at the end of the week. Now, I'm just wondering from our team, is there anything else that anyone else would like to say? Because I don't want to say any more.
I think for me, while the students, a couple of the students did say it was a little bit daunting because it wasn't the same placement and they weren't sure how it was going to fit in with their training that they were doing and their modules that they had to fill out. Once they had the first proper team meeting with all of our team, they just seemed to relax really well and just fit in as if they'd always worked with us. And I think it's because, yes, sometimes we talk about very hard-hitting subjects, like the mortality review, which is really hard-hitting. We talk about real-life problems that people face day to day. But we always do it compassionately, we always do it inclusively, and we always do it with a little bit of fun if we can, because we know that, you know, you can't have a hard meeting and then just leave people at the end of it feeling vulnerable. The fact that we work so closely together, I think they enjoyed that, and it helped them just fit in so easily. Nearly everybody in our team at the end said, "Oh, we're going to be really sad to see you go. We've really enjoyed working with you. You fit in so well. You're all really lovely. You listened to us, really listened to us. You talked to us, you asked us questions. You weren't frightened to ask difficult questions." So I think, yeah, it is really, really beneficial for us as a self-advocacy group, and I think for students alike. I think it's been one of our favourite partnership working that we've done.
Yeah.
And we've done lots.
I would definitely agree. We've got a quick exercise that we'd like to involve people on. If that's, we do lots of activities throughout the training. I'd be very grateful if people could grab a piece of paper and a pen. And whilst you're doing that, I'm going to do my best. Can everyone see this video? Hurrah, it's worked.
Yes, it's there.
Okay, so as we said, we do lots of activities, and we try to make our sessions as interactive, because no one enjoys spending time looking at 48 PowerPoint slides. So we're going to play you a video of a lady with a learning disability going to the hospital, and we would like you to write down a number from 1 to 10 on a piece of paper. 1 being, actually, that's really bad, and 10 being, that's excellent, similar to Strictly Come Dancing. And what you're doing is you are rating the receptionist and the doctor in the video clip. Is that okay? So hopefully that's full screen now. Is that right? Okay.
Yep, that's right.
Have I got sound? Yeah, lovely.
There's no sound, Andy.
Yes.
There's no sound?
Nope.
Oh, I thought I was doing so well there. Let's try again.
Yeah.
Hi, I've got an appointment, I think, but I'm not sure.
What's the name?
Rosie Ellison.
Okay. Yes. So you'll be with Dr. Gobbledygook at 5 to 14:45. It's just through that door to your right. Then take another right, a left, 2 lefts, a right, and a right. It'll be just behind you. There may be a bit of a wait, I'm afraid, around 1,800 seconds or so, but we'll try and see you as soon as we can. Who's next?
And you say you've been feeling quite tired recently.
Yeah, a bit. Mostly in the evenings, so I don't know if it's just...
Well, I don't think there's anything to worry about, but I would like to try you on some new medication.
Right, okay.
Just a precaution. See if you respond differently. So, you want to take these every 85 hours, 2 times a week for the next month and a half, and these 4 times every 3 days for the next 2 weeks, unless it's a bank holiday.
No, sorry. Stop. Can you just go back? I'm just not following.
Of course. I understand this can all be a little confusing at first. I'll try not to go too fast. But really, once you've got the hang of it, it's as easy as ABC. CAB. BB. ABC. CBABB. So you'll take these every 3 to 4 to 5 days, and these every 4 to 5 to 6 days, unless it's a day that ends in Y, because that can be quite dangerous.
Mancap new campaign is called Trimming Well. Sign up to listen to my story here.
So that's a video that we use as part of our kind of training, and it was created by MenCap, and we're part of a Treat Me Well campaign, which looks at making sure that people with a learning disability receive the right care and support within hospitals. So I'm going to ask if everyone could think about the receptionist first of all, and hold up to the screen how you would rate the receptionist. So Samantha, I'm seeing a 0. Michelle? Another 0. Oh, my cat. Sorry. Anyone else want to put anything in the chat, or I've got a 1 from Danielle. Ian's got another 0. And Claire, you've got a 0 there too. Okay. So I think, and Gemma's just put a 1. So I think it's fair to say that the receptionist didn't do a particularly good job. What about the doctor? Oh, I've got a 0 again. And Gemma has put a 0. Okay, I'm seeing lots of 0s. So I don't think they'd be going through on Strictly.
Michelle 0 has a really sad face. Love it.
Just in terms of why did we rate the receptionist, and particularly the doctor, as being so poor in the way that they supported the lady in the video? What were some of the things that came up for people? Claire?
Hi, I found it was an overload of information. So what we would do, we would write, if there was a lot of information for a patient, we would write it down on a piece of paper, step by step, for them, so they can understand it and take it away with them to look at later.
Fabulous answer. Yeah. So I don't know if you noticed, obviously the letter that she received first of all was very long-winded, and sometimes we have words that are very difficult for all of us to understand. One of our advocates got an appointment letter recently to go to the phlebotomy department at the hospital, where it could have just said to have your bloods, to have a blood test. So there are lots of words and abbreviations that are very complicated. Did anyone else want to add anything? No. Okay, Danielle.
They weren't taking on board that she wasn't taking on board what they said. I mean, I laughed at the directions, because that is what I am like the minute anybody starts saying left and right, left, right. I have to pause and think, I don't even know which is my left, so that I've not taken on board any of the rest of what they've said. And it's the same kind of thing. They weren't listening and judging whether or not any of the information made any sense or not.
Thank you. That's appreciated. Michelle.
Yeah, they didn't demonstrate any insight in terms of like inclusion, isn't it? They just put everybody in one box, that everybody should just understand this direction and what they're saying, instead of actually maybe looking at somebody's notes and seeing if they do need that extra support and what reasonable adjustments they can put in place.
Yeah. Absolutely, and that's the message that we want to get across. We use those words, reasonable adjustment, but it just means getting the right support, and that sometimes just involves making someone feel comfortable. It doesn't need to cost lots of money. It's just about building that relationship with people so that people can feel more comfortable and less anxious when people go to hospital. So got 2 more slides, and I'm hoping this is going to work this time. Ian.
When something is working well, we just want to share it. We would encourage all universities to connect with their local self-advocacy groups and find out about how self-advocacies work.
Thank you, Ian. And Samantha.
So we would like it if you have any questions you might have about our work or how we've supported the students on community placements. So we're opening up the floor to you to ask us anything at all. Claire.
I would just like to add from your comment when we first started that we don't have anything disability-wise in with our module. We do. It's just with COVID, we didn't get to see anybody. It was we had people who were going to come in and do talks, not advocates. Well, advocates for themselves for Down syndrome, but there was a lot of problems with transport and getting out. But that we have got it in, but we just haven't been able to access it this year with COVID.
Thank you. And Claire, can you remind us what is your role?
Oh, sorry. And we do podiatry.
Okay, yes. Sorry, you just put that in the chat.
Yeah.
Thank you.
We did find, obviously, when COVID came, we had to change the way we work. All of our work was done face to face. That's the way we work best. And we had to change it. So we're very aware that obviously schools ended up having to close, universities ended up having to close, people had to do things online. So lots of things changed. So this is why we also think that these community placements are really beneficial, especially now that we're coming out of all of that, because being on Zoom's not quite the same. It's better than nothing, but it's not quite the same as actually being in person and having that in a group. You can be in a group full of people, but you can have a moment where you go off and talk to somebody in private. You know, you can go around the room and gel with people a lot better than when you're sitting in a room and then suddenly someone will go, Michelle, you answer the question. It's like, whoa, you've put me right on the spot. So we can appreciate that it's obviously been very hard for you guys as well. So
yeah. Any other questions?
Actually, I've got a comment because we did, I think, Danielle, you said that you'd talked to an advocacy group this week. That was one of the training sessions you had done.
Yeah, yesterday a Darlington-based advocacy group came and spoke to us about the different kinds of advocacy services that are available. That blew my mind.
Yes, because a lot of people, unfortunately, there is a difference between advocacy and self-advocacy. So it's good that you know, you're getting to learn about all the different kinds of advocacy.
Michelle.
For me, really, it's more of a comment and just saying thank you so much for the work that you've done and supporting the students. And even during the planning meeting, Tony was one of those key people leading those conversations. It's been absolutely fantastic to see the work of self-advocates and how it can impact in terms of learning for students. I know that obviously you're quite a relatively small organization and you need time to run things in such an organized manner. But I think in the future, I think we did have a conversation to see how we can maybe possibly support podiatry students, even if they're to get a taste of a day or two, and then for them as well to bring their knowledge and the value that they have. I can see Tony's giggling away.
Yeah, sorry, my cat keeps making an appearance.
Trying to join the team.
No, forgive me. So,
because we're such an awesome team, weren't we?
I am so sorry about that. I'm just laughing because his cupcakes are walking through the screen and he always does it in other meetings, doesn't he, Andy?
sorry, yeah, I did say to our team, I need to be a bit more professional. So,
Honestly, Andy, don't worry. In our team, Danielle, I'm going to put you on the spotlight. Danielle's got a few cats, and sometimes they also like to show up in our team meetings. Occasionally, just pop up and say hi.
Yep, generally she turns up, she sort of turns so everyone can see her tail, and then there's a button on the top of my keyboard with a picture of a moon on that basically just kills the power. I think it must be like a night mode, and she comes along and she presses that and kills whatever I'm doing in the middle of it. That was why I said my pets make me smile, but sometimes they make me cross.
Yeah. My cat's actually done that in a meeting, just came across, and obviously I was on mute at the time and didn't notice my cat had hit my unmute button, and I was going, Crowley, will you stop it, for crying out loud? And people then just looked at the screen and people were like laughing, and I thought, oh no, what have I done?
Oh wow. Yeah, it's typical, isn't it, on these kind of meetings? But like I was saying, just a heartfelt thank you. And Philip, you know, I hope you get to enjoy Ed Sheeran when you go to your next gig. Oh, Tony's showing off her pet there. And then, you know, Ian, Matthew, thank you all so much. And, you know, Samantha and Andy, you know, for facilitating and all the work that you're doing with the students. And I know that there's some more, isn't it, due in this March that are coming through. So what we want to highlight for those in practice, you know, to just promote advocacy services and see how we can, you know, have students go and have that, you know, to learn from that, from those experts by experience, really, and then linking in maybe with those specialist learning disability nurses within our NHS trust as well. So thank you very much.
Michelle, can we just say one other quick thing? So there are self-advocacy groups all over the country. So we know that we've got different health trusts represented here. And we would really encourage, if you haven't already done so, to get to know your local self-advocacy group. There is a map which we can share of where all the self-advocacy groups are, with kind of contact details. But I promise you won't regret it. We work with some amazing self-advocacy groups, including Your Voice Counts, Skills for People, but they're dotted all over the country. So, you know, that would be our plea. If you haven't already done so, just pick up the phone, get to know your local self-advocacy group. And I've got one more question, and Tony already knows what I'm going to ask. Is there any possibility?
Can you take a photo,
Yes.
Andy?
Would people mind if we took a photograph to share on Twitter?
Yep, that's
You
fine.
don't have to, it'd be in the picture, but I'm going to do a little, this is where everyone kind of starts doing their hair.
I am.
I don't have to worry about that these days, but so I'm going to do 1, 2, 3. Lovely. And if with your permission, I'll share that on Twitter.
Andy, Philip's hair wasn't quite right. Take it again.
Philip's got the same amount of hair as I have, so I'm not.
Hey.
So can we just say a massive thank you to Michelle, particularly, and Danielle for coordinating today's Lunch and Learn session and inviting us to present. And thank you so much for everyone that's joined us. If people would like to keep in contact with us, you'd be very welcome. Our Twitter handle, do you call it a handle? Is @Sun People First.
And also, just to say, we shared some photos of our health and wellbeing session, which Andy said is on a Thursday, 10:30 till 2:30 at City Space at Sunderland Uni. You're more than welcome to come along and join us. You'll get to meet lots of very interesting people. We do lots of inclusive, fun exercise, and it will be just a great opportunity to get to talk to people, meet people, and get to know your local self-advocacy group and have a laugh. We have lots of fun.
Sorry, where was that at in the time?
It's at City Space in Sunderland University, and it's 10:30 till 2:30 on a Thursday.
You can stay as long as you want.
Yeah, and you don't have to join in the activities if you don't want to, but I guarantee we've had people turn up going, oh, I'm not into sport, I'm not into fitness, and then they're donning boxing gloves, or they're throwing a basketball into a hoop, or, you know, playing a bit of cricket, whatever, you know, within 10-15 minutes of meeting everybody. So it's good fun.
Yeah.
I even do some running on occasion.
Yeah, I've tried that. It's more of a shuffle for me. Is that a Wednesday, did you say?
Thursday. Sorry.
Oh, all right.
But I'll show off with me basketball skills and show off the sound.
Yeah, you used to play basketball, didn't you, Tony Ann?
When I was at Castle Green, I used to do basketball tournaments and everything. But I've just done all my bus pass and everything. And they've just told us now it's not going to come to 28 days or 30 days. So I'm going to wait till then.
Oh, goodness. So, yeah, simple things like bus passes are a real nightmare for our team, aren't they?
And I've got to pay bus fare and everything now. And it's cost me £4. It's going to cost us £4 every single day.
Well, Tony Ann, we can have a conversation about that, because I think I can support you in that. So thank you, everyone. Have a lovely afternoon, and a great weekend.
Yep.
And we shall hopefully be in touch if anyone's got any further questions through Michelle and Claire. Did you have your hand up? Was that you?
Sorry, I asked lots of questions. I was just trying to, because regarding the fact that we haven't spoke to anybody within the disability within our podiatry, sorry. I was just wondering, because we do clinic on a Thursday, but we have been doing other clinics elsewhere on our clinic days on a Thursday. So I was just wondering, who would we contact if I wanted my lecturer to see if we could like come over one day, like a couple of us from our group, into one of the sessions?
I'll put my email in the chat, Claire.
Right.
Claire, is your program lead Tracy?
Yes.
Yes, I've provisionally talked to her about it, but definitely we'll link up the conversations with Andy as well, and say, obviously, this is something that'll be very much useful and, you know, educational for yourselves.
Oh, well, I'll let you do that with Tracy then, but I'll just mention that I've spoke to you. Yeah. But yeah, I think it would be good.
Yeah.
Okay, thank you.
Thank you.
And just a thank you from me. It's been my favourite session this week. I've really enjoyed meeting you all. Thank you so much for your time coming to talk to us.
No, thank you. That's lovely. Thank you.
Oh, we love talking, don't we?
Yeah, now we've got a good team meeting next. We're going to have a good laugh then. You've been to Lee. Oh, you used to go to school at Lee.
Whereabouts in Leeds, Phil?
It was Hawksworth Hall, wasn't it? Guyley? Kylie? Guiseley.
Guiseley is where I'm from in Leeds, or just next door to where I'm from in Leeds. I'm from Eden.
There's a big manor house called Hawksworth Hall.
There is, yeah.
It was for learning difficulties and physical difficulties. It was a school. And that's why I went to school.
All the best people went to school in Leeds, Philip.
We wanted to say it, so I passed my test when I was 50, and we drove, 51, and we drove down there. We rang the doorbell and they wouldn't let us in. You only wanted to have a look around the outside and they wouldn't let us in. Yeah.
I do apologise, everyone. I'm going to have to go. So thanks very much for joining us, and have a lovely afternoon.
Thanks.
Yes, thank you, everybody.
Bye.
See you all.
Bye.
Take care.
Yeah.